Hello everyone, this is Dr. Shyam. I welcome you all to my channel Dr. Pharma, and on this video I'll be discussing on the types of the wound healing. So broadly speaking, there are basically two types of wound healing, and one is healing by first intention, also called primary wound healing, also called primary union. All those are similar terms. And healing by secondary intention, or you can say the secondary wound healing, or you can say the healing by secondary union. The most common difference between the primary wound healing, or you can say the healing by first intention, and the healing by second intention is that it is a closed wound healing. This one, primary intention, it is a closed wound healing, and in this case the wound is left open. So you can see there are some characteristics of primary wound healing, or you can say the healing by primary intention, and in case of secondary wound healing also. So those characteristics are, in case of primary wound healing, you can see here the wound is clean and uninfected. It is surgically incised without much loss of cells and the tissue. Surgical incise means the wound is tied with by using needle and the thread, or you can say the edges of the wound are approximated, or you can say the tied by surgical sutures. Whereas in case of secondary wound healing, as I told you, that it is, in this case, the wound is left open. It means that the surgical suture is not used here. So that is the main common difference. Remember that in case of primary wound healing, the wound is the wound is closed by surgical sutures, whereas in case of secondary wound healing, we are not using surgical suture. That is the main common difference between these two. Now we'll see the sequence of events which are taking place in case of primary wound healing as well as secondary wound healing. So the first one is initial hemorrhage. Initial hemorrhage. So as all of you know that hemorrhage means bleeding, and of course when there is a cell injury, or you can say the cell has been injured, there will be a bleeding, right? Of course there will be a bleeding. It is called hemorrhage. And see, as you know that this, in case of this wound healing, this cells, the wound are surgically incised. So after that there will be a this will fill with the blood. The wound is filled with the blood, and there will be a blood clot, and that clot will prevent from the dehydration and the infection. So remember that the first one is initial hemorrhage. Second one is acute inflammatory response. Acute inflammatory response. See, you know that in case of inflammation, I have discussed in detail. When there is a cell injury, there will be a inflammation as well, and that inflammation is due to the release of chemical mediators. I have discussed in the previous video. If you want, you can just go and see that video. So the second thing is that after initial hemorrhage, there will be a inflammation, and this this inflammatory response occurs due to the appearance of the polymorphs, and that polymorphs is replaced by the macrophage. Okay. Third one is epithelial changes. Epithelial change. So epithelial change means nothing but you can say that after that the next step is there will be a formation of the new tissue and the new cells in the form of epithelium, or you can say the damaged cells will be replaced. I told you that may be in the form of regeneration, or in the form of repair, or you can say by the growth of the parenchymal cells as well as the growth of the connective tissue. So epithelial changes takes place. After that there will be a organization. Organization means in this case there will be a the fibroblast. Remember that the fibroblast and the collagen, they helps in the wound healing. So they will invade that. They will invade the wounded area, and they helps in the healing. It is called organization. And finally suture track. Suture track means finally you are going to, or we are going to remove the suture track, because I told you that it is a closed wound healing. There is a suture track, so we are going to remove the suture track after, you can say, around 7 days or maybe 10 days. That depends upon the severity of the infection, and we have to remove the suture track very carefully. We have to prevent the complications. You can use the adhesive tape and the metal clips to remove the suture track. So remember that the sequence of events in primary wound healing is, the first thing is that initial hemorrhage. The second thing is that means bleeding will be there and the blood will be clotting there, as I told you, to prevent the prevent dehydration and from the infection. And then there will be acute inflammatory response, epithelial changes, or you can say the formation of the new cells from the epidermis, and then organization, and the last one is where we are going to remove the surgical tract. So this is just sequence of events which are taking place in case of primary wound healing. Now moving to the secondary wound healing, the sequence of events, the first one, see here, the first one, second and third. So in case of secondary wound healing, or you can say in case of open wound healing, there will be initial hemorrhage, there will be acute inflammatory response, and there will be epithelial changes. But as you know that in this case the wound is not surgically incised, so there will be a formation of the granulation tissue. There is a formation of granulation tissue, and this tissue is formed by the fibroblasts, and then you can say the neovascularization from the viral elements or new cells. And the granulation tissue which are formed here is, it will be red, it will be deep red, and then they are fragile. Fragile means they are very weak, because as you know that this is the this is the new tissue which are formed, which are forming in case of wound healing. That is why they are fragile in nature, or you can say weak in nature. And then next one is wound contraction takes place. So see normally you might have observed that, right? Sometimes you might have injured, you are not going for the surgical suture. Normally you are keeping the wound open. After a few days you will see that, after 1 week, or you can say after 10 days, you will see that your wound is automatically getting healed or getting recovered. It means that the wound contraction is taking place. So due to the action of myofibroblasts, the wound contraction takes place, and in this way the wound healing is taking place. So remember that in case of wound healing by primary and secondary intention, the first point, second and third will remain similar. In this case there is organization and suture tract, whereas in case of secondary intention there is a formation of granulation tissue and wound contraction is taking place, because you know that it is a open wound healing. So that is the the brief information regarding the primary wound healing and the secondary wound healing, and I hope it is clear. So I hope the video is useful. Please don't forget to subscribe, like, share and comment on my video. Thank you all.